Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. There are two big issues to talk about this month, one involving the Veterans Administration and the other involving the Medicare program on competitive bidding. First, the VA. About 2 weeks ago, the Veterans Administration issued a proposed regulation that would dramatically change how the VA has done business for the last 50 years. The VA typically uses private practitioners to augment their internal prosthetic and orthotic capacity. They are now publishing a proposed rule and seeking public comment by December 15th that basically states that the VA has the sole authority to determine where the patient goes and to which prosthetist or orthotist they are permitted to access. That's a big change from prior policy where veterans have had the right to decide which prosthetist they wish to see, whether that prosthetist is a VA employee or has a private contract with the Veterans Administration. So that's a big issue, the one that the NAAOP is strongly opposed to, especially in light of the Injured and Amputee Veterans Bill of Rights, the legislation that's in the House to ultimately ensure that veterans have a right to choose their practitioner. So we're working with the Veterans Administration. While doing so, we recognize that the VA House Committee is right in the middle of marking up legislation to permanently authorize the Choice program. This is the program that the Congress passed about 2-3 years ago that allowed veterans to access private providers if they live too far from a VA facility or if they waited too long for an appointment. They're trying to authorize this and codify the law permanently and to expand the program so that it's not just a temporary short-term solution to the VA's problems. How orthotics and prosthetics is impacted by this law is really quite unclear. I've read through the law, we've analyzed the law, and it's not clear in the legislative language how orthotics and prosthetics would fare under this new law. We'll be following up with the VA staff and with members, especially our champion of our Injured and Amputee Veterans Bill of Rights, Congressman Tim Walberg. Next, MedPAC, which stands for the Medicare Payment Advisory Commission, and their newfound issue that they're addressing, which is competitive bidding of non-competitive bid items. The MedPAC Commission held a hearing and a work session last week, and one of the topics was the competitive bidding program. As you know, competitive bidding does not or has not been applied to any orthotics and prosthetics since its inception in 2010. But it does apply to off-the-shelf orthotics. The statute permits competitive bidding for off-the-shelf orthotics only. CMS has regulated that off-the-shelf orthotics is a fairly broad swath of orthotics rather than the very narrow and limited self-adjusted orthotics that the statute envisioned. Nonetheless, the MedPAC has been looking at recommendations to expand competitive bidding to other areas that are not currently competitively bid. One of the reasons for this is that they've noted that the Medicare spend on competitively bid DME has decreased by about 50% since 2010 when the program went into effect, and yet the spend has increased by about 24% for non-competitively bid DMEPOs. And so this is a major new threat to the field, and it's something that NAAOP and the rest of the O&P Alliance organizations will be confronting in the near future. Both of these issues raise significant concerns. NAAOP will be publishing additional materials and asking for your help on the NAAOP website. We encourage you to visit the website occasionally and check in to see how you can help transmit the O&P message to Capitol Hill and to other areas in Washington. And let me end on one final note. Our past president, Paul Pruzakowski, deserves tremendous congratulations for his impending nuptials. Congratulations, Paul and Kara. Thank you.